Hello, my name is Charity Oyedeji, and I am a hematology fellow at Duke, and we're going to talk about hemoglobinopathies. We'll start off by talking about sickle cell disease management. There are several hemoglobinopathies, but the most common hemoglobinopathies you'll encounter are sickle cell disease, beta thalassemia, and alpha thalassemia. All of these hemoglobinopathies have various subtypes. Sickle cell disease has numerous subtypes, but the most common one you'll see is hemoglobin SS. You'll also see SC, S beta plus, and S beta 0. The thalassemias are usually ranked by their level of severity. And so you have beta thalassemia minor, intermediate, major, and you have alpha thalassemia minor, hemoglobin BART, and hemoglobin H. Normal adult hemoglobin is called hemoglobin A. And hemoglobin A is made up of 4 subunits, 2 beta globin units and 2 alpha globin units. And the beta globin units is encoded by the beta globin gene, which is on chromosome 11, and you inherit one of these from each parent. For the alpha globin gene, you inherit 2 genes from each parent, and that's on chromosome 11. So for sickle cell disease, that's a mutation of the beta globin gene. The most common one you'll see is hemoglobin SS, which is one of the most severe forms of it and the most common. You tend to have manifestations like vaso-occlusive crisis, which is by far the most common complication. So patients will come in with pain in any part of the body. They also can have things like acute chest, strokes, avascular necrosis. They can have spleen issues. They can have pulmonary hypertension, kidney disease. Any organ can be infected by sickle cell disease. Patients with SC disease, which tends to be a less severe form but still has some significant manifestations that can be a little different than SS. Patients with SC disease tend to have more severe retinopathy compared to other patients with sickle cell disease. They also can have issues with their spleen, so they can get splenomegaly, they can get splenic infarctions. They also tend to carry a higher hemoglobin level. So for these patients, you have to be careful when transfusing and try not to transfuse them above 10 or 11, or you can cause hyperviscosity, which puts them at risk for strokes. So if you have a patient with SC disease with acute chest and you want to transfuse them, consider doing an exchange transfusion so that you don't add too much blood and make their blood hyperviscous. You also have patients with S beta plus, which is less severe than SS disease, but still has significant manifestations, and they still have vaso-occlusion and pain, just like all other patients with sickle cell disease. And you have S beta 0, which is just as severe as SS disease because these patients make no hemoglobin A, so they tend to have very similar manifestations as patients with hemoglobin SS. So, sickle cell disease is caused by a missense point mutation on the beta globin gene. Normal DNA sequence on chromosome 11 encodes a glutamic acid at the 6th position of the beta globin. That leads to round, flexible red cells that don't get occluded. They don't cause occlusion in the vessel. However, when you have sickle cell disease, you have this point mutation that leads to a valine that replaces the glutamic acid at the 6th position. This causes polymerization, especially at deoxygenated conditions, which leads to sickling of your red cells. They're stiff because they're polymerized, and they are not as flexible, so they get stuck in places where they shouldn't. And so you develop manifestations that you see, vaso-occlusive crisis that causes pain, you get strokes, you get retinopathy, you get all the manifestations that you see of sickle cell disease. And so, like I said, you can have problems anywhere from head to toe. And so this is a good diagram to look at to see all the organs that are commonly infected by sickle cell.